medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Hi everybody, this is the final installment on how to diagnose coronary artery disease, or at least be given a hint that it is in existence. And of course, any of the blood tests that we've described on our first 3 installments, it is important to match them with these and make a decision on what further things that you could do. Many fields do not follow these and should follow these tests. They are well written about, and please take the time to look into it. Today I want to describe the plaque 2 test, or the LPPLA2 test. It's an activity marker of a rupture-prone plaque formation. We can get plaque, but is it subject to being ruptured? Well, when you see this, it's highly expressed in what we call necrotic core of arteriosclerotic plaque. There's a 2.1 time increase in the risk of coronary vascular disease, CVA, MI mortality. So you need to check that and to normalize it. Normally it should be less than 225. If it's not, you need to treat this quite aggressively. Another test that you can look at is myeloperoxidase activity. It's released by the white blood cell, the macrophages, and it is in response to an injury of the arterial wall. You'll see it in early plaque formation as well as at MI. No one measures it at MI, but it is being released. And it's actively involved in the progression of arteriosclerosis and chronic inflammation of that arterial wall. And it's linked to vulnerable plaque as well. It's 2 times increase of coronary vascular mortality. It should be less than 470 picograms or picomoles per liter, and it is related to the oxidized LDL. Now, when the oxidized LDL occurs and there's ApoB that's elevated, and you see inflammation from the C-reactive protein that you saw before, and you see triglycerides being elevated, and you see homocysteine elevation that we talked about, and you're seeing the plaque 2 test. These are a good sense for you as a clinician to be saying, we better be doing something about this. Now, you have to look at it. We did not do a series yet on the treatment of this, but certainly that may be for a future look at, and certainly for a future look as doing a webinar on this, because treating this is available. It is not part of the conventional armamentarium that we would expect to have, but for certain, there are so many things from the integrated perspective, including intravenous vitamin C, some oral medications, actually conventional medications will help, and you need to look at all these as a whole. Is your patient prone to getting coronary vascular disease? That's the question of a wellness doctor or a wellness healthcare practitioner. If the answer is yes by seeing many of this tests, then it's our job, actually your job as well, to do the right things by your patients to prevent an event. I'm Dr. Mitch Ghen. Thank you so much for watching. For more information, go to drmitchghen.com. That's drmitchghen.com. Thanks again for watching.